Welcome to Own Your Heart Health. I'm Dr. Regina Druz, your holistic cardiologist. This week, we will dive into common heart health concerns, uncovering root causes, and unpacking scientific discoveries and controversies. The information provided does not constitute medical advice. Please contact your healthcare practitioner before making any changes that may impact your health. Hi, everyone. I am beyond excited today because I managed to get a great guest for our show. His name is Dr. David Albert, and he is a very special cardiologist. Now, he has been an inspiration to me personally because I had started in my entrepreneurial journey maybe much later than people actually think I did. You know, it wasn't even in my 40s, it was in my 50s. And Dr. Albert has been one of those inspirational senior cardiologists who had shown me that you can have more than one version of cardiology career. And I'm not only inspired by his experience, I'm inspired by the philosophy behind his innovations. And this is why he's here today. Welcome, Dr. David Albert.
Well, Regina, thank you for the invitation. First of all, you're lying because I know you're only 39.
Okay, you guys, ladies and gentlemen, you heard it here first. I am only 39.
So, I know because I'm an old man, and I can tell a young woman when I meet one. So thank you for this invitation, and I look forward to a lively discussion.
You got it. So I'll ask you the same question I ask all of my guests. How did you grow up to be this version of a cardiologist? Give us your story.
Well, life doesn't always go in a straight line. And when I was a medical student at Duke back in the late 1970s, my mentor was a guy, the late Dr. Galen Wagner, who was really a tower in electrocardiography. And when what happened was my father had an MI. Mm-hmm. I was about 8 months from finishing medical school at Duke, and I went back to where he was living in Oklahoma. And when he was discharged from the hospital, they told him, a cardiac rehab program, but he lived in the boonies. By the way, he lived to be 91. So this didn't really impact his life very much, but they told him you got to walk until your heart rate is 120. And
okay.
Then, and then you need to slow down and take it easy. He was walking. He would walk with about 4 dogs along these country roads in rural Oklahoma. And he was a very sophisticated guy. He was a Rhodes Scholar. He's a brilliant guy, actually. So I knew that there was no way he was going to be able to monitor his heart rate. So we had no Apple Watches, no Fitbits, no Oura Rings, no
smartphones,
no smartphones, no cell phones at all, no chest straps. So this is 1988, and so I knew he needed some kind of tool to monitor his heart rate. And he wasn't going to go to an in-house, phase 2 cardiac rehab program because he lived way out in the boonies. And that was a long way. It was 125 miles from the University Medical Center where he was at the University of Oklahoma. So I went to one of my classmates at Duke Medical School, had been an undergraduate biomedical engineer at Duke. And he had one of his classmates who was getting his PhD in biomedical engineering. And he introduced me to him. He said, well, this guy might be able to help make you a heart rate monitor. I said, great.
Okay.
So the guy said, I said, well, what's it going to take? He said, well, you got to give me $200. Well, $200 in 1980 to a medical student meant that even my ramen noodle budget was impacted. I mean, that was a tremendous amount of money for me, but I did it. And 2 months later, he came to me with this electronic breadboard with all these wires on it. He says, well, it doesn't work, but that's all I'm going to work on it. I was so angry. I was so angry that he had taken advantage of me. I didn't know. I was ignorant. And at the time I was working in a cardiology lab at Duke, a basic science lab. We did animal research. That's when you could do animal research. And I used oscilloscopes and all kinds of electronic equipment and early computers, early personal computers. And so I got so angry, I went to the dean of the medical school and the dean of the engineering school. And I went to my dad and I said, I want to become an engineer. Now, I only had 8 months left at Duke. And I was going to go back to the University of Oklahoma, where ultimately I did, but where the chief of cardiology was a very famous cardiologist named Ralph Lazzara, who, by the way, introduced me to Paul Kligfield and Peter Oken at Cornell, where you trained.
And where I trained was Paul Kligfield and Peter Oken. Yeah.
Very good. They're very close friends of mine to this day, both Peter and Paul. There's no Mary in there. It's Peter, Paul, and Regina.
Well, Mary was actually in the Echo Lab.
There you go, in the Echo Lab. So that's what I did. So I took a leave of absence from medical school with 8 months left, and I spent 2.5 years in engineering school, becoming an engineer, then went back and finished medical school. And by that time, I built a heart rate monitor that I later licensed, and I built an ultrasound machine. And I sold that to a company called Quinton Instruments that made treadmill stress test systems. And then I went back to Oklahoma. I graduated. I went back to Oklahoma for my training, and I got married, and we had a baby. That happens. My wife is now a rheumatology faculty at USC. She was a Duke medical student starting when I was finishing my 6-year voyage. So I came up with a new invention. It was basically an EKG microscope. Did something called signal averaged ECG, looked at things called late potentials, and nobody wanted to license it. And I had already licensed these. I was driving a Corvette I bought for myself when my classmates were, driving used VWs and eating ramen noodles. I felt pretty good.
You had that entrepreneurial lift, right?
I had already succeeded at least in my inventor, with my inventor hat on. So I went to my wife and my dad and I said, I'm going to drop out of cardiology and become an entrepreneur and start a business. Now, Regina, I knew nothing about business. Zero, nothing. I had a lawyer help negotiate these license deals, but I knew nothing. And my mentor at Duke, Dr. Wagner, and my mentor at Oklahoma, Dr. Lazzara, both said to my parents and my wife, we had a baby, and it's okay. Dave will come back and be a cardiologist. You don't need to worry. It's easy. He's got a plan B if this fails. And of course, everybody thought it'd fail. I was not dumb enough to understand I would probably fail. And
well, the chance of failure was pretty high. You have to admit.
Very high. And by the way, people leaving medicine to become entrepreneurs, it's much more common today. In 1987, it wasn't common at all. It was zero common.
It was unheard of, honestly.
And let alone have a wife who's an internal medicine resident and a baby. I was not thinking straight. But to be honest with you, I've never looked back. And 4 companies later, 90 patents. In 2001, I sold my company to a little company called GE Healthcare, and I became the chief scientist of GE Cardiology. And I've been fortunate enough to succeed, even despite the odds against me. And it's been a tremendous journey, because really I'm an academic physician who happens to be in industry. But I don't care about marketing and human resources and sales and manufacturing. I care about helping patients and innovating to help patients, just like you do, just like with, holistic heart centers. And so, my latest endeavor. So by the way, I'd started 3 companies, and I promised my wife that I would never start another.
You're like 1, 2, 3 was the budget.
I'm 55 years old. And I'm going to start another company. She looks at me and she goes, you lied to me. And I go, yeah, I did. I'm sorry. But this is okay. Well, that was 15 years ago. And AliveCor now is no longer a tiny startup. We're really a pretty significant company. We have partnerships with GE Healthcare and Omron for blood pressure and the wireless chip company Qualcomm. We have phenomenal investors and a significant global business selling in 45 countries. We have a product line from a credit card single lead ECG to a revolutionary 12 lead you can put in your pocket. And I continue. I'll be on a dozen papers this year. I'm conducting international clinical trials. I get to have fun. I'll be going to Northern Ireland and Madrid to the European Society of Cardiology.
I will see you there in Madrid.
I say, please come by our booth, and then I'll be going to Australia, to Sydney, to my friend Ben Friedman and my other friend Prash Sanders in Adelaide. And so I get to, my wife, she's a smart lady, okay? 4 kids and now grandkids later, she goes with me on these trips. And so we've literally been to Moscow before it became bad, and it was not great when we went there about 8 years ago. And we've been
I'm just not even going to go there down the Moscow lane at all.
Yeah, okay. I mean, well, I visited. I gave lectures at multiple hospitals, and that's what I usually do. I've been to Qatar. I've been, all over Europe, the Nordic countries, South America, Asia, Hong Kong, Shenzhen, Japan, all over. And that's been a wonderful experience. Met many wonderful cardiologists. I gave a keynote at the Asia Pacific Cardiology Conference in Busan, South Korea, back here about 5 months ago. That was a great experience. Met, cardiologists from Singapore, China, Vietnam, Japan. It was an interesting experience, and so I've had a great run. And today,
you are having a great run still.
Well,
it's not like you're having a great run. Well, you're reinventing cardiology every single day.
Well, you're very kind to say that. Other people said that, and I just shake my head and go. I have to tell you, a friend of mine, Dr. Nasir Marouche, who's a world famous electrophysiologist. We have this new meeting called HRX, which is put in by the Heart Rhythm Society, but it's really it's a cardiology innovation startup meeting. It's not like ACC or HRS or ESC. And at the first one, he walks up to me, and it was in San Diego, and he says, "You're the reason we're doing this." And I was like, "Oh, Nasir, I cannot take credit." He said, "Yeah, but you started this." And I said, "Well, you mean I'm to blame, is what you're telling me." I'm to blame. So that was, and I think all these things we embrace innovation in cardiology. We're a technology oriented specialty. People, use a lot of different technologies, non-invasive technologies, invasive technologies, sure, implantable technologies. And, I think people are, one of the things I may say that I did is that I saw that we had to engage the patient more, just like you do every day. We have to. Why? Because an engaged patient will change their lifestyle, will take their medicine, will have better outcomes, okay? And will work with their physician to run through the issues. And the issues are like, I got a little muscle pain with my statin. I've got a little GI upset with my GLP-1. Well, those are things you work through. And so as we do it, and if you're an engaged patient, you're an empowered patient, you'll be a better patient and you'll have a better life. And so I think we all, I saw this coming, and I saw that these smartphones were going to be the remote control for our lives, which they absolutely are today, whether it's, I get my grandkids pictures, but I do my banking, I do my, call
you can't live without it, right? You sort of like don't leave home without it.
In 2010, when I first brought up the idea of a smartphone connected ECG device, people told me, well, the people that need it are 65. They don't have a smartphone. Well, about 20, 30% of them did. But now today it's everybody. Because like me, their grandkid, they want to see their grandkid pictures. They want to, they want to call their Ubers. They want to see their bank balance.
My parents learned to text and to use Facebook, right?
Correct. And that's exactly right. So the world changed. And so if I did anything, I saw to where the skate, where the puck was going. I didn't skate to the puck. I skated where the puck was going. And that was empowering patients, wireless, having them be, taking care and taking monitoring to where the patients are, not bringing them to us. And so that's where we are today. And I think, it's accelerating. We see, it's not all positive. You usually it's fits and starts, progress. It's never a straight line, but we see things, the hims and hers and rows, kind of democratizing the access to medication that used to be behind the desk and the white guy, guide gal in the white coat. And I think these things, we're going to work through them all. But ultimately, it'll be better for everybody. We'll lower costs, very important here in this country, and we'll improve outcomes. And that's really the goal.
Hi, everyone. It's Dr. Regina here. I know there are contradictory opinions about nutrition for heart health and longevity. Discussion often gets heated and confusing. There are those who push for low fat, low cholesterol. Then there are fans of a ketogenic diet. There are many anti-meat voices as well, suggesting vegan or vegetarian style of eating. With all the chatter out there on what and how to eat, my team and I decided to create a tool for patients, medical professionals to clear the clutter. It is called Holistic Heart University, and it provides on-demand courses, nutrition and lifestyle resources, information on supplements to make it easier to understand how to make healthy choices for your heart. I'm especially proud of our open office hours for program patients and the Q&A feature where you get to ask your individual questions and put us in the hot seat. Head out to the show notes for the link and use my special promo code to get a huge 20% off on our annual health and wellness subscription. The code is OWNER20, and I'll see you in the office hours. I think the points that you're bringing up, at least, to me, because first of all, your journey is extraordinary and inspirational. I actually did not know that you sort of got out of medical school, then came back to finish it. I thought it was more of a straight line, but to do this, especially in 1970s, that's sort of like unheard of. But what is really attractive to me and what I try to always accomplish is that I want to give patients that agency that they can have to shape the trajectory of their health, to shift from listening to all sorts of noise to finding the real value in things that they're using. And for our listeners, by the way, we're a young podcast. We don't take any sponsors. So people that you have here on the show are the people and the companies whose technologies we're actively using in our patients, on myself. I do that quite often. And because we had seen the value. So the first time I encountered this little gadget, which was basically like one of those, like a little piece of plastic with two electrodes on it. And I put my fingers on and, it got me that single lead ECG. And I remember, I was very amused by it. And we were at a restaurant, my husband and I with another couple. And one of them, our friends, one of them said, we had like a glass of wine or two. And my friend says, well, I don't think I'm feeling well. I have some palpitations. And I said, you know what? I can tell you right now, right this second, if we have to worry about it or not. Why don't you just put your fingers right on it and 30 seconds later, we'll have an answer. And fortunately, it wasn't anything serious. It was just, sitting down, drinking a little alcohol and stuff like that. It was not atrial fibrillation. Yeah, exactly. But I think the power of this device also comes from the fact that we are seeing this increased frequency of arrhythmias and actually heart disease is getting younger. We're finding it in much earlier patient groups. And I think the fact that we can actually give people a non-invasive, fairly inexpensive and accurate way to understand one of the most fundamental electrical properties of their heart is so empowering. So I want you to talk about that. What's been happening, in the atrial fibrillation, all these, detection screening trials, kind of like what's been the arc of development?
Well, we have over 250 peer-reviewed publications dealing with Kardia devices. And so I can tell you many of them, a whole bunch of them have to do with AFib screening in various populations. People in Hong Kong screened 50,000 people. Jason Andrade up in Canada screened 18,000 people. So we know we can find AFib in undiagnosed populations. We also know that the demographics are, the longer you live, you're more likely to develop AFib, and the number one comorbidity, hypertension. So as you get older, if you have uncontrolled hypertension, your probability of getting AFib goes up. It goes up to almost a third over the age of 80. So we're able to find these people, and we know we have effective therapies. We know, ablation, and now it's very simple with pulse field ablation. You can get in and out in 30 minutes, and it's very safe. And so we can treat it that way. Plus, we have excellent anticoagulants. Eliquis is a wonderful drug. I have no vested interest in BMS Pfizer, but it's a great drug, and it does a great job, and minimal bleeding issues. So we've got good therapies. There are more coming, and so finding people earlier is always better. And that's true for heart disease. That's true for cancer. It's true for anything. But I think we also understand the demographics. We understand the relationship with obesity, sleep apnea, hypertension, diabetes, the
cardiometabolic, right? Cardiometabolic relationship.
And now we have, with GLP-1s, I mean, you may or may not know, our oldest son is an obesity guru. He trained in internal medicine, was on the faculty of Cedars, and is an obesity medicine specialist in addition to a board certified internist. And he has a cardiometabolic practice. He takes care of lipids, he takes care of hypertension, he takes care of diabetes, and he takes care of obesity. And as he says, and more papers say, GLP-1s don't just reduce weight. They make your lipids better. They make your blood pressure better. They may stave off dementia. They have all kinds of benefits that we
I have to say, I am so impressed by these medications. And, at Holistic Heart Centers, obviously, a lot of our practice is cardiometabolic. Yeah. And so we use microdosing protocols, which, of course, is an off-label use. But, as a physician, we can certainly
do whatever you want.
We can do whatever we want. So, and it really made me look into the literature behind these medications and actually put a course together. We call it Heart and Obesity. And one of the interesting things I discovered is that there appears to be, with the contemporary imaging technologies, we can actually see deposits of ectopic adipose tissue, or EAT, in various areas of the heart, including surrounding left atrium, which is, of course, the birthplace of atrial fibrillation. And
that fat tissue, it generates it's a chemical factory.
Correct.
And so it generates a tremendous amount of vasoactive and electroactive substances that impact the heart and can help generate AFib.
And it's inflamed, and it actually, what even blew my mind is that based on the imaging techniques, there is evidence, it's histopathological evidence, that these inflamed fat tissues, or EAT, they actually infiltrate the myocardium itself. It almost behaves like local cancer, just burrows through the myocardium, which is, mind-blowing.
Well, I think again, one of my friends is a world famous cardiologist, Eric Topol, and he speaks and publishes all the time. And he again, like most of us, is awed by the power of these GLP-1 peptides. And I can tell you, there's a whole pipeline of drugs coming, and retatrutide is one of the next ones. And they say it's even better than tirzepatide.
The triple ones. Yeah,
it's the triple agonist, and so just the dual agonist like tirzepatide. And I just saw a post. The guy said, well, my patient was in the trial and had to come off the retatrutide for the end of the trial. And I put him on tirzepatide, and guess what? He says it's not as good. It doesn't work well. And so the future looks really good I will say we obviously, the cost of those medications, I don't fault the companies for trying to benefit from the benefits they're bringing to us, but to really realize the benefits of these medications, like we realize the benefit of statins and antihypertensives today, they're going to become generic. And when they become generic,
think so too.
we will see globally tremendous impact on cardiovascular outcomes.
And yeah, I agree. And I have to tell you that, for me, sort of the mental transition, because being an integrative cardiologist, of course, we prioritize lifestyle first, right?
Yeah.
But what I find is that lifestyle is that foundational piece that we always have to work on and have in place. And when you do provide this foundation, adding appropriate medications, even at a lower dosages, which is what we do with microdosing, is extraordinarily powerful. And, and the fact that we have monitoring technology, I think I spotted you wearing your Aura ring, wearing mine, of course, right? So
I was going to bring this up. I mean, we have the ability to monitor integrative cardiology, monitor sleep, one of the AHA's life essential 8s. Yes. And a very important one, as we learn that all the garbage in your brain is cleaned up. The garbage collectors come through when you're asleep.
Yeah, your lymphatic circulation, right?
Exactly. And so we're as we learn more, we learn the power. And this to me is my sleep monitor. Okay. And the correlation between, I think I had a poor night's sleep, and then I look at my sleep number and I go, yeah, I did. Shouldn't have had that glass of wine or whatever it was. And so that's helping to empower the patients. That's helping you guide their lifestyle changes, Regina.
100%, because we monitor not just HRV, but we also monitor stress resiliency. And I can tell you, in addition to sleep and sleep efficiency, in my personal journey, I noticed that, it took me some time to sort of recalibrate my house routine. And before it happened, I had these very abrupt sort of, oscillations in my stress resiliency. I could be very high, and then all of a sudden I was kind of will be at the bottom of that scale, right? Yeah. But since I really restructured what I was doing, how I was doing, while there's still fluctuation, I'm no longer hitting the rock bottom, right? So this, I think, is so powerful in this N of one. And, coming back to AliveCor, I honestly feel that each household, in my personal opinion, this is what I tell all of my patients who have any heart issue, whether it's blood pressure, they have palpitations, known atrial fibrillation, we have that too. To really have one of those devices at home, because it's inexpensive, it's easy to use, and it's literally an opportunity, at least in my mind, when I first saw it, what was striking to me is that you no longer needed a medical appointment or cardiologist with a bulky ECG machine. You could actually get this super important piece of information, share it with your doctor or share it with the doctors who are in the app, and get an answer when it really matters, like right now. That's to me.
You're absolutely right. And just like with your friend at dinner, one of the things we receive 1.3 million ECGs a week into our cloud, people using it. We have over 1 million active customers using Kardia devices. And what's the number one thing that people compliment us on? Peace of mind.
That's right.
Okay, yeah, these are my PVCs, or I'm waiting for my ablation. Yeah, this is my regular AFib I'm feeling. It's peace of mind. And that's critical, because again, your mind has a huge impact on your heart. The neurocardiac axis is well understood. And if all of a sudden I'm nervous, well, there go my catecholamines, there go my stress hormones, and my heart will respond.
Of course.
So that's an important notion. I want to bring up one anecdote. So when we sit here and talk about it, in 2012, I was invited to Seattle to give an invited talk at the Heart Failure Society of America, which is a big heart failure organization. And the session, the moderator of the session was a relatively unknown doctor named Eugene Brownwald. I took his book and I had him sign it at the time. I have it right over here. So literally the world's most famous cardiologist. He and Topol may trade off, but he was the moderator, and I got up and gave my talk to a packed audience, hundreds of cardiologists. And at the end, questions. This guy raises his hand. He stands up. Dr. Albert. Okay. But this is a single lead ECG. It's not a 12 lead ECG. Now you got to understand, I was ready for that question. I knew.
Of course, you came prepared.
I was ready for that question, and I go, "You're absolutely right, sir. I'm not trying to diagnose a STEMI with this. However, I will say, how many leads does an automatic external defibrillator or an implantable defibrillator use to decide it's going to save your life?" And I pointed my finger. He just sat right back down because the answer is one.
One, of course.
A single lead of ECG gives me 75, 80% of the information I need. Yeah, there's 20% I don't have. I need more leads, whether it's 6 lead or certainly 12 lead. But instant notion, if somebody hasn't passed out, what's their rhythm? And we have literally hundreds of thousands of anecdotes, people, testimonials. I mean, we've recorded 340 million ECGs since we started. And so it's been a wonderful journey, and as you say, it's still going. Absolutely, it's still going. But and I've been able to meet wonderful people like you who care for patients every day. Well, your dog is barking. Guess what? It'll make my dog start to bark.
I know, but that's fine. That's part of life.
I'll pet them, and I said, "Now I'm going to be on a podcast. My dogs understand me completely."
But that's life.
I said, "Don't." Of course it is. If I had grandkids here, they'd be climbing on my lap, going, "Grandpa."
Of course, and wanting your attention.
Who's this nice lady? So Regina, this has been a great benefit. AliveCor, I feel like we've done some good and helped move cardiology. The value became apparent during the pandemic when people couldn't go to their doctor's office. Our business doubled in 1 year. Well, of course, because people couldn't go to their doctors, were scared to go to their doctors. The doctor's offices were half-masked, and it became apparent to a lot of people. Telemedicine came of age.
I know. I was part of it.
I had a telemedicine visit 2 weeks ago. I got another one next week. It's a regular. My wife does them routinely. It's a regular part of medicine today, but that's only because it had been around for a while. It's only because the pandemic got people to say, "Wow, this works," and doctors accepted it because they could get paid for it. So, medicine is changing. It doesn't change fast. Doesn't change easily. We have to prove whatever innovation we're bringing up that it has clinical value, financial value, but we're getting there, Regina. And
let me ask you a trick question, right? Trick question here, because so I was a very early telemedicine adapter. In the integrative cardiology, obviously it lends itself well to telemedicine, and so during the pandemic, of course, we already had the setup, and it was a fairly easy switch for us, sort of like to flip. And actually, my current practice model is 99% virtual. Right. So we sort of flipped the model, on its head. But I'm very curious. So just as pandemic, it unleashed this opportunity for telemedicine, right? And let's call it positive externality, right? Telemedicine in many ways a radical innovation. And, in business arena, this is what people talk about, these externalities. We now sort of at the preface of an enormously impactful innovation. And what I'm seeing, and of course it's generative AI, and what I'm seeing is the emergence of what I call citizen doctors. Right. So this is, and I get this routinely. We have this question in our intake form, which it says, what is the health concern that you have that we can help you with? And so what I started to get recently is literally copy and paste of generative AI outputs with a full top to bottom analysis of lipids and who knows what else. And, and I don't think that, prospective patient actually understands everything that's being said in there, but they are being bombarded with this information. So how is AI reshaping what you're doing with AliveCor? Because I'm already a user of one of your more advanced technologies, the 12-lead electrocardiogram. And how do you think it's all going to pan out, both for professionals and for patients who I call them now citizen doctors, right? They're self-diagnosing, and it's a whole different level. It's way beyond Dr. Google. It's just a whole different level that that needs to be recognized for both positives and for the negatives.
Well, you're absolutely right. First of all, I'll give you two historical points here. Number one is the chairman of board of my company is a very famous billionaire venture capitalist, Vinod Khosla. He was a co-founder of Sun Microsystems and has been huge. And he wrote a piece in about 2010-11 where he said that 80% of what doctors do will be done by AI. He's been a huge AI advocate and been pushing us to use our data and develop AI, which we even have an Ask Kardia, which is a generative AI solution for patients using answering their basic questions about AFib or hypertension, whatever. So what do I think? Well, what I think is the technology is running faster than our ability to really assimilate it. And, kids today, well, what we found out, education, it's going to be revolutionized by it. Mm-hmm. So the schools that are able to help their students utilize AI, generative AI appropriately, will win. Those that think they can ban it will lose. Okay. It's the old notion of radiologists who use AI will replace radiologists who do not. It's not AI will replace radiologists. And we saw this yesterday. I saw the article that gastroenterologists with AI somehow became less capable. Now,
colonoscopies. I saw that article too.
So we got to figure all this out. So we're still in early days. I mean, ChatGPT was just be 3 years ago. It's and they just introduced and pulled ChatGPT 5 in like 2 days. It got bad results and they pulled it back before.
Pull it back. Not ready.
And hallucinations are real. We've seen it. Somebody told me, I think I saw on Twitter or TikTok, one of the social media sites, that a doctor put in a bunch of information and it came back with and created a new bone that didn't exist. So we're going to work through those. It's early days. It will become a huge tool for us as providers, but also for people themselves. To get a question, you got a question 11:30 at night, but you're not going to call your doctor. You don't want to go to the emergency room. You're going to be able to ask. I can tell you that Eric Topol, I saw him. He gave a keynote in about 2014, and he put up a slide and he said, "This is my current situation." And he said, "My patient comes in and hands me a Kardia report and says, 'I have AFib. What do we do now?'"
Right.
Okay. So the patient came to him with the diagnosis. And so now we have to, work together holistically to help guide that patient to the best outcome. So I think it's a huge tool. It's inevitable. It's a tsunami. And I think we're, like many things, we're going to figure out how to best use it as it is itself evolves rapidly, because you've never seen, technology in Silicon Valley. I was just at our headquarters in Mountain View, where Google's headquartered, and that's all anybody talks about is AI, and then generative AI, large language models, and the power it's going to bring to us. And I can tell you, we have a lot of innovations and development at AliveCor that will utilize that type of technology, and it's inevitable that it will help us.
Hi everyone, it's Dr. Regina here. Many of my colleagues and I are noticing patients coming to us with self-ordered blood tests. When this trend started to gain momentum, I thought it would benefit many patients. After all, who doesn't want more access to health testing? However, I see that self-ordered labs often lead to more confusion and frustration for our patients. Patients are coming in with a pile of labs, and sadly, they're not better off for it. This is why we at Holistic Card Centers have launched Heartwell Toolkits, a curated collection of blood and genetic markers that one can get at home, focused on heart and brain health, gives you all the data you need to make informed and actionable health decisions. The toolkits can be ordered at our shop on holisticcardcenters.com. You can find the link in the show notes. Use the code TESTING10 to get 10% off and free shipping. I agree, because I have to say that in my own practice, as all these data streams come in from our patients, because you already could see that, we use a lot of biometrics. Yeah. There is certainly, in addition to Oura rings, all these biometric scales and blood pressure cuffs, and, it's sort of like old streams to us, and really trying to discern the patterns, give a patient a guidance that is actionable, right? Something that they can do today, something that they can do this week, not generalities, but really help to map out their personal path. This is what I'm most excited about, because this is sort of like, this is the opportunity, right? So it's literally my cardiology bag. I'll tell you a little vignette. When I was chief of cardiology, it was a bunch of years back. It was a small community hospital that was under contract with a larger local healthcare system. And was the first time in my life where I actually didn't have cardiology fellows, because they didn't have a cardiology fellowship. They had family medicine residents. And literally my first day on the job, as I'm in my office, this resident comes in and her hands are shaking. And I said, well, what's wrong? What's going on? And, she sort of sheepishly pulls out a copy of an electrocardiogram and says, can you please take a look at this? This is an ECG. I can't read it. And I said, why don't you sit down? Let's have some water. It's only an electrocardiogram. I'm sure we can figure it out. Plus, you and I, and she knows too, there is an automated version of this interpretation. Sometimes it's off, but most of the times it's sort of correct. And so it occurred to me that what tremendous value we have in providing this sort of unimpeded access to technology, which is reliable, but also portable, and could be in the hands of either professional or a patient, right? Just like ultrasound transducers that I used to carry in rounds, and I started carrying it back then because, we had a lot of patients and we had to wait for the ultrasound technician. Well, guess what? You also have to wait for an ECG technician, right? So wouldn't that be phenomenal? There you go. You see, so that's one of those. I have a different company, but it's still the same thing. And I sort of said, this is where the future is actually heading. It's not just increasing access for patients, it's also increasing access for professionals who may not be cardiologists, right? Just like that resident who really needed help from ECG interpretation to make a clinical decision.
Well, that I was a few months ago, I was asked to come give a talk on AI in cardiology and AI and ECG at a community hospital here about 15 miles north of Los Angeles. They only have family medicine residents. So they don't have any other family medicine residents. And they had this really cool tent, and there were cots and things where all the residents were. And they were from 3 or 4 different countries, but they were all wonderful. And, I had a 2.5 hour, 3 hour, it was just, my talk was 20 minutes, but then it was question after question. And they brought me ECGs and said, well, can you go over this? And so I can totally relate, Regina, to that. And those are the frontline doctors. And this group, there was a young woman who was in her last year, so 3rd year family medicine resident. She's from Ukraine. Okay. Mm-hmm. She'd come here and she says, I want to be an AI-enabled doctor. And I said, in family medicine, nobody needs it more than you, because everything in the kitchen sink is thrown at you. You need help. And you're going to have it, you're going to have help right here. Just like when I was a medical student and we had these little books that we wrote our notes down.
And little cards. I remember that, little cards.
I had the Washington Manual. God.
Yes, I remember Washington Manual too.
Manual. Now you're connected to the world's intelligence, and you're going to have, it will be a huge tool for every practice of medicine, for nurses, for doctors, for pharmacists, everybody. And so I think the future is incredibly bright, but like with anything, it won't be a straight line. It won't be without hiccups or bumps in the road, but ultimately it'll be great.
It'll be a jungle gym. And so David, who should consider getting a AliveCor, the Kardia device? I usually recommend to my patients just a single lead, the more original device, not the 6-lead one. So who would you say should get this and have it for preventative purposes?
Our single lead device is very inexpensive. I think it's like $79. You can get it either Amazon or CVS or Walmart, Best Buy, all kinds of places. Anybody who has palpitations, anybody who has a diagnosis or who's worried about it can get one, because you can also get a board certified cardiologist to overread that. Mm-hmm. So even if you don't have a cardiologist yourself, like you can send it to, you can pay money and have a board certified cardiologist read your rhythm strip, which gives you some information, again, so you can show up at your doctor and say, I've got AFib, or I've got PVCs,
or an SVT, right?
Yeah. SVT. Oh, yeah, we've got SVT, VT, all kinds of things. So that's it. I mean, we have, with our 6-lead device, we have the opportunity with FDA clearance to monitor people's QT intervals. And so you have people taking all kinds of medication that prolong QT. Not just cardiac meds, but psychiatric meds and GI meds, cancer meds. And so I think that for that group, there's a very specific application. And then obviously our 12-lead device is meant for practitioners. I just had another concierge cardiologist, one I know here. And he said, I need to buy one. He'd been in practice. He says, my patients now want me to come to their home. And he's got he has his own CT scanner in his office and things. He said, I need one of your devices because I can't carry anything else. And I said, great. Here it is. And he said, I have to tell you, he said, is that all it costs? He's used to, a guy bought a CT scanner for his office. So I said, yeah, it's a little less expensive.
He'll be working off the CT scan for a long time.
Yeah,
but
he's going to be working off. That's right. He's got a note on that CT scanner. But these are all the other things that, you talk about AI. I just had a conversation with a guy named Jim Min, another Cornell doctor. Jim's got his clearly that have revolutionary AI for characterizing plaque in coronary arteries. And together with HeartFlow that just went public, doubled their stock price in a day, we can tell you that you're developing plaque long before you have any symptoms or any manifestation. We can appropriately direct you to statins, if you needed PCSK9, GLP-1s. And so that's revolutionary, because that finally means we can predict your trajectory. And in medicine, prediction is prevention. And that's what we all want to do. I was just looking at heart failure doctors. I think, Mike Gibson was on with Martha Galati, both friends of mine. Mike Gibson's from Oklahoma. Martha was here, Arizona, then came to Cedars, and now she's off to be a leader elsewhere. But they were talking about dealing with heart failure, a huge issue.
Sure.
What we need to do is prevent heart failure. We need to prevent big heart attacks. We need to prevent MIs. We need to early detect and treat amyloid, which we have some amazing drugs to do. We need to prevent. And if we prevent, then that heart failure won't be the issue, because once you've got an ejection fraction of 20%, you're on a trajectory that's not a good one. Yeah, we have things we can do. Oh yeah, we can do
But
LVAD.
that's that's very different.
But your life will never be the same. And so
I think what you're bringing up, this primordial prevention, is such a tremendous opportunity, because
it's huge.
When we do our imaging, and I'm a cardiac imager by training and in my early career, and I have to say that the ability not just to see the fractional flow reserves for various stenosis, but to see the plaque. And actually, most recently, we started doing carotid intermediate thickness imaging and actually gauging people's vascular age and vascular age progression. Because with the AI technologies, what used to be the technical limitations are really receding very quickly. So, I've been surprised to learn how many patients who, fairly young and they look fairly reasonable blood work wise, and you put a transducer on their neck and you see this carotid plaquing, you see the thickening, and you understand that they are actually vascularly in a much older age group than what their driver license says. So I think that's opportunity. The true longevity is in that primordial prevention.
The AI, I mean, my friends at the Mayo Clinic, full disclosure, Mayo Clinic's an investor in my company, but they've been pioneers, Paul Friedman, Sachi Attia, and now just recently a paper came out of Columbia and New York Hospital Cornell on Echo Next. My Pierre Elias, another Duke Med grad, I just was on with Pierre. And so take a 12-lead ECG and tell you that you're developing poor left ventricular function, you're developing valve disease, you've got an insight into structural heart disease that gives us an early insight, Regina. And again, primordial prevention. You said it perfectly. That's a promise. And I think, this AI is going to help us deliver that.
AI and trailblazers like you. So, because
we'll get you everywhere.
Yes, because we need people who are able to bring innovations. And most importantly, I think, one of the biggest contributions, or at least mindset shifts in cardiology right now, is that there is a different playbook emerging. And, and this is what's important, because
but people like you are using that playbook.
We're using the playbook all the way, for sure. For sure. Well, David, it's been a pleasure having you. Thank you so much for sharing about your journey and AliveCor. And, I am super inspired. I can't wait with the next set of gadgets or algorithms that AliveCor comes through, because I love my little, tiny little box that houses my 12-lead ECG. I love showing it to patients on my iPhone, and they're like, "That's my ECG." I'm like, "Yeah, let me actually email it to you." Click, and it goes right in. So, it's.
Thank you for this invitation. I'm a fan of yours. So this has been nothing but a pleasure for me.
Excellent. We'll speak soon.
Take care. Bye-bye.
Bye. Hi to all professionals listening to us today. If you're thinking of launching a cardiometabolic or integrative cardiology program in your practice, we can help. At the Holistic Card Centers, we help docs in practice to expand into hybrid or concierge services. Head out to the show notes and click on the application link. Your intro call is entirely free. Ready to schedule a practice review? Use code DOC10 for 10% off our Practice Power Hour 16 minutes coaching session. The link is in the show notes. Thank you for tuning in to Own Your Heart Health with Dr. Regina Druz. This podcast is powered by Holistic Card Centers. If you enjoyed the show, please rate and review us on your favorite podcast platform. To learn more about our services, visit holisticcardcenters.com and subscribe to our YouTube channel. The link is in the show notes. See you next week.